So what we just did is we visited all the clinics that are ready, very ready to start this morning to give the first immunizations in New Brunswick. So we're really quite excited. People are very pumped up. They're believing it's a historic day in the Miramichi. So people are more than ready. There are members who are assisting today from all parts of the system.
Do you know how many, like, I assume 2,000 vaccines in a weekend is quite a lot. Do you know what kind of hours people are going to be given? Karen?
Yeah, so I think they are going to be working 12 hours each day.
How many people are vaccinating?
How many people are vaccinating?
Yeah, vaccinated, sorry. Yeah.
Yes, the vaccinators. I would say, I didn't do an accurate count, but I would say there's probably about 25 vaccinators downstairs. Yeah, and then there's people who are registering people, so there must be probably about 150 people downstairs, between runners, between screeners, between vaccinators, people looking after the recovery areas. So I would say an estimate is about 150 people.
Well, number one, the surveys across Canada and the surveys here in New Brunswick show slight differences across the country. Certainly here in New Brunswick, the survey information that we received was that about 75% of New Brunswickers are keen to get the vaccine. Now, whether they are the people who are in the high priority groups or whether they're people who are in a lower priority group that will get their vaccination later. There are 7 different vaccines. They all have different profiles with respect to what they're made of, what their efficacy is, and what the side effects are. So for the very first one that we're doing today, the common side effects would be pain in the site where you got the injection. Some people would have fatigue, muscle aches and pains, and those are probably the most common ones. Some people would actually have a fever. But if you lined up all the different profiles of the different vaccines that are going to be available over the next year, again, they all have similarities, but they all have slight differences.